Thank you, madam. Thank you so much. Thank you, Hindi team. Now we are moving to the English session. Today is our 1997th day of continuous webinar. Thank you all the participants and faculties for your presence here. Thank you so much. Before beginning the session, we'll have a silent prayer. Good evening and welcome once again. Today is our 1997th day of continuous webinar. Today we are discussing about the importance of relevance of finishing school of homeopathy. Not today, tomorrow and yesterday also we had the same discussion with the different panelists. Today we have 4 panelists here: Dr. Manoj, Dr. Avi Sharma, Dr. Mariam Salcedo, and Dr. Prakash Rao. And we are discussing about the finishing school of homeopathy. Because we all have a degree, we are receiving a degree. Just receiving a degree doesn't makes us doctors. Receiving degree makes us doctors, but not a good practitioner. The confidence is coming from the practice, continuous learning, and experience. So I am inviting our panelists for discussing about the subject. Dr. Mariam Salcedo, she is from Bolivia. Dr. Manoj, you please made her as a co-host.
He's already co-host.
Okay. Then you can open the this one. So she is from Bolivia. She is our IFPH coordinator of Bolivia, and she is a graduate professor of research methodology, Loyola University, Bolivia. You are most welcome for the discussion. You are welcome, please.
Thanks, ma'am. Good evening to all of you. Good morning in South America, in La Paz City, Bolivia country. It's always an honor for me to share with you all, and thanks for this discussion so important about the gap, bridging this gap. So the need for finishing schools in homeopathy for clinical excellence and professional competency. The question is, are we producing doctors or degree holders? And that is a very deep question, especially in South America, because in South America, homeopathy is just spreading. We have different kind of countries, as Brazil or Argentina, that they have a very good development of homeopathy. But in general, the population believes that homeopathy is just something for the mood to fight with depression, with anxiety, sometimes with insomnia, and that's not real. So we have a lack of practice in acute cases. It is both an honor and a responsibility to address a question that strikes at the very core of professional integrity in homeopathy education. Are we producing competent doctors or merely degree holders? So bridging the gap is not a rhetorical expression. It is an urgent academic and ethical call, a call to ensure that our graduates are not only knowledgeably in theory, but clinically competent, professionally responsible, and capable for delivering safe and effective patient care. Today, I would like to reflect on the need for finishing schools in homeopathy, especially in South America, as structured, supervised clinical training environments that ensure excellence beyond graduation. Here in South America, you need to start the medicine career, that it will take you 6 or 7 years according to the country, and then you have to take the homeopathic training. It could be something like 2 or 3 years according different kind of countries and schools. So we don't have universities to have that training in homeopathy. Homeopathy is something like a specialization of allopathic medicine, but we have to face a big trouble there, because when the allopathic doctor comes into an homeopathic school, they have to change all the chip, all the mind, and sometimes it's very difficult. They have to forget everything that they learn to relearn a new point of view of health and how we treat the process, illness, health. The South American context, regulation and responsibility. Homeopathy in South America has a long-standing institutional presence. Several countries have taken regulatory steps that demonstrate the seriousness of professional standards. In Brazil, homeopathy has been officially recognized as a medical specialty since 1980 and incorporated into the public health system in 1991. Physicians must complete approximately 2,300 hours of postgraduate training to obtain specialist recognition. This is not a symbolic requirement. It reflects the understanding that clinical competence requires structured supervised formation. In Argentina, homeopathy is practiced primarily by licensed medical doctors who pursue formal postgraduate education through established institutions such as the Homeopathic School of Argentina. We have both the AMA and the EMA from Tomás Pablo Pasquero. These programs integrate theory with supervised clinical practice, reinforcing professional accountability. In Colombia, regulations similarly restrict homeopathy practice to qualified medical professionals, again emphasizing patient safety and professional legitimacy. These examples reveal an important truth. South America is not lacking tradition in homeopathy. What we must strengthen is the transition from academic instruction to clinical mastery. So the gap between knowledge and clinical competence across the region, numerous institutions offer programs in homeopathy. Some provide solid theoretical foundations, others include limited practical components. However, not all programs guarantee sufficient supervised clinical exposure to ensure that graduates are ready to manage complex real-world cases independently. And that's a big trouble because we don't have hospitals with homeopathy. We just have the private consultation, and in all that clinical training practice, we just see a few patients, and follow-up is really low according to what we need to see and understand and observe. Knowing materia medica is not the same as managing a multi-pathological patients. Understanding repertorization is not the same as making safe, evidence-informed clinical decisions under pressure. Completing a curriculum is not the same as being clinical accountable. A finishing school in homeopathy is designed precisely to address this gap. Such institutions will focus on intensive supervised clinical practice, structured case analysis and follow-up, differential diagnosis integrations, ethical decisions-making frameworks, documentation and outcome evaluation, interdisciplinary dialogue where appropriate, and this is not remedial education. It is an advanced professional refinement. So that was the most important, the main objective of Loyola University, to have this postgraduate course. So our students have the medical degree, then they have the postgraduate homeopathic training, and then they have a super specialty in Loyola University, according clinical homeopathy and studying all the miasmatic sphere. So let us confront the central question honestly. If a graduate holds a diploma but lacks sufficient supervised clinical exposure, do we consider that person fully prepared to assume independent responsibility for patient care? In most health disciplines, medicine, dentistry, physiology, physiotherapy, supervised clinical practice is mandatory before independent certification. Residency programs, internships, and supervised rotations are not negotiable components of professional formation. Why should homeopathy aim for anything less? Without structured finishing programs, we risk producing professionals who are academically certified but clinically underprepared. That is not only an educational issue, it is a matter of public trust. And maybe this is the most important trouble that we have to face in South America, because we don't have sufficient training in acute cases, for example, or infections like the last pandemic time. So we are following your steps in India. And that is a great treasure that Ifph offers us daily. So the clinical excellence is not optional, it's an ethical duty. And finishing schools strengthen the applied clinical reasoning, case management, consistency, professional ethics, outcome evaluations, and reflective practice confidence grounded in competence. Moreover, in era where integrated medicine and interdisciplinary collaboration are increasingly relevant, homeopathy practitioners must be prepared to articulate, justify, and document their clinical decisions in professional environments. So to truly bridge the gap, we should consider establishing a standardized competencies frameworks across institutions, making supervised clinical hours a core requirement for certification, creating structured finishing school programs of 1-2 years focused on clinical immersion, encouraging clinical research and outcome test documentation, and strengthening mentorship systems. This is not about increasing bureaucracy, it's about increasing credibility. So excellence is not achieved at graduation, it begins there. If we are serious about advancing homeopathy as a respected clinical discipline, we must ensure that our graduate transition into confident, competent practitioners capable of managing complexity with responsibility. Finishing schools are not a luxury. They are a necessary bridge between academic learning and professional mastery, because ultimately our mission is not to produce individuals who collect diplomas. Our mission is to form clinicians who hear responsibly, who think critically, who act ethically, and who uphold the highest standards of patient care, following the thoughts of Dr. Samuel Hahnemann. So let's ask ourselves with intellectual honesty and professional courage, are we producing doctors or merely degree holders? And if the answer is not yet what we aspire to, then it's our responsibility to build that bridge. So thank you very much for this opportunity to share what is happening in South America and homeopathy.
Thank you so much, Dr. Maria Salcedo. Now I am inviting Dr. A.V. Sharma for sharing your views.
Hello, everyone, and thank you for inviting me to share my views on the importance of finishing schools. Because so I actually have been like apna student of homeopathy from year 2007, and before that I have been seeing homeopathy in my family, and I'm a fourth generation homeopath, so I do know the importance and relevance of the guidance in homeopathy and how big a role it plays in students or a doctor's life when he starts practicing. So when in our foundation day, on a foundation day, when we start our education as a BHMS first year student, we have been told that homeopathy is the art and the science. So science, when we talk about, we actually tend to learn it from the books, but the science part has always been lacking. And finishing my MD and then my PhD, it actually gave me a very, very stark reality, a very big lesson that we as a homeopath are lacking when it comes to clinical practice and when it comes to clinical exposure to our students. I have been fortunate to teach few students at like very reputed colleges in India, and when I used to go to teach them, I used to ask my students, why are you in homeopathy? And they all used to say one thing. Mostly they used to say one thing, because we couldn't get admission in MBBS. And we are actually seeing in like reputed colleges in India, homeopathic reputed colleges in India, we are actually looking at a trend that a first year student is coming at the age of 23 or 24. And tell all my students that when I was 23, I had completed my graduation. So you are 4 or 5 years behind me. And when they graduate, when they reach their fourth year and they just give their fourth year examinations, and it would be a very, very difficult pill to swallow being a homeopath. But I'll need to say this, that every homeopathic college in this country is giving 10-year question papers and are not at all aspiring students to be a good clinician. They're just asking them to mug things up, write things in a certain way, and just pass on from first year to second, and then so on. And in internship also, this trend continues. The importance of finishing school comes in the clinical practice. The clinical the way we are supposed to talk to the patient, that is very, very relevant. When we are talking about clinical practice, we'll need to know that once we start talking to the patient, it is our vocation, our oration, the way we pronounce and announce things, the way we actually try and mingle with them in their own wordly way. We actually make a connection with them. And that is how you tend to get the symptoms out of the patient. And that is how you actually prescribe the medicine. The totality does not come from the patient, because it is very difficult to take symptoms out of a patient on first visit. It is so difficult because the patient would like to stay in the cocoon in its shell, would want to lie in front of you. Why would he want to tell you the things that he has actually not shared with even his family members? Why would he come and just tell you those things on the day one? But it is the ability to initiate the conversation and take the symptoms out. My father used to say this: fishing out of the symptoms. So once you go fishing, you'll have to just keep the bait on the string and just wait for the patient to take that bait, and then only you can actually take the symptom out. And it is not just my father's practice that have benefited me. N number of doctors whom I visited, whom I actually had to work really hard to connect to. Because these doctors, why would a doctor ask me to come sit in his chamber and just give him the years of experience that he has learned from many trials, many failures, and he would just come, oh, you just take this? No, it doesn't work like that. I had to show my efficiency, I had to show my zeal that, okay, I am ready to just wait and you just give me what I want. I've been very lucky that I have been blessed to be in company with many doctors. And that is what is lacking in today's world. When it comes to students, they do not have the zeal to go to a doctor and ask. If a doctor is actually asking you that I do not allow any intern or a student to sit in my chamber, you'll need to go again, and you'll need to keep on going, because it is you who would get benefit out of the doctor and not the physician. I would also want to tell you one more thing. When it comes to all the stalwarts of homeopathy, they all were not homeopaths. They all were from some other field, but the zeal to learn, the basic commitment to get better with this pathy was something that drove them to become a good homeopath. Starting from Henneman to his most like the most favorite disciple Boningason, to Kent, to Herring, all of them, you see the same thing: the zeal, the know of the nature to know more, the appetite to know more. And I think that we have been lacking this. And if in case I when I do meet students, and I'm very happy that coming from a very prestigious institute like Nehru Homeopathic Medical College, and these students, they are so interested in learning. And when I tell them, when I ask them that you should opt for research, they do not even know that even in their first year they can write research articles, review articles at least. So that is what is lacking. We as a doctors, we as a homeopathic doctors need to know that collecting degrees will not help us, will not help the pathy. It will just make degree holders. But if in case we guide these students, if in case we guide ourselves firstly to be a better homeopath, that would be a much beneficial part. And when it comes to clinical practice, these students when they come to me and then ask me, ki, sir, have you seen this doctor? He does not even have a valid degree and he's been practicing and he just like practices so well and his patients also say that they are getting better, but we can't actually, we if we prescribe medicines, we cannot produce the same results because this doctor who has been practicing since 40, 50, 60 years, he actually started homeopathy because it was his interest to learn, and you are just practicing to get some money out of the patient, and it is not at all right. It should not be the case. When we are in our college, when we are in our college days, we have been told that homeopathy cures, homeopathy does not have side effect. We'll need to amend our words. Homeopathy cures and homeopathy does not have any side effects, provided we are giving medicines homeopathically. We use homeopath. This is a classical homeopath and he's a homeopath who gives multiple medicines. No. Homeopath is a homeopath. The mongrel sect, it has been given, the term has been given to a homeopath who give n number of medicines. It has been denoted by a Henneman. So if in case a person is practicing homeopathy, he will practice on a single medicine. But if a person is giving multiple medicines, then I don't believe that a person is practicing homeopathy. It will have side effects and it will not cure the patient for sure. So this is the importance of bridging the schools that help us. I have personally have been helped with so many doctors. To name a few, Dr. L.M. Khan, Dr. Sunirmal Sarkar, and Dr. Rajan Sankaran. Dr. Sunirmal Sarkar coming from Kolkata, and Dr. Rajan Sankaran, a Maharashtrian. A person who has been like Dr. Rajan Sankaran working because of his father working on doctrine of signature, and Dr. Sunirmal Sarkar working on the Elenian or the Bengali practice that we say. And when these two doctors merged together and they actually taught students, that was like the perfect thing that could happen to us, to me at least. So the importance is the importance is that we need to keep a check on what we are teaching our students, and we need to push our students to go towards a betterment, and to tell them that you yourself will need to develop an appetite so that you can do better in your life being a homeopath. Thank you, with which I would want to rest my case.
Thank you so much, Doctor, for your views. As you said, we are concentrating on exams, how we pass the exams. That is the main aim when we are studying. Then only whenever we are getting patients, that time only we are struggling with the patients. Then only we search for the help. Anyway, I'm inviting Dr. Manoj. He's MD in Homeopathy. He's the coordinator of Ifph. You are welcome, Doctor. You can share your views here.
Thank you,
Please.
Dr. Ajani. Said definitely a nice chapter. I think it should have been done around 20, 30 years back, but that never happened.
Yeah, exactly.
So anyway, we have to high time to discuss all these things. I think first of all, we should start the finishing schools from our teachers. They should first practice it, because they are the person who is the culprits, because they are always forcing the students to study some other things. They are always discouraging students. It often happens. Recently, one of the students, he got an MBBS and then studied homeopathy. He's a gynecologist also. When he started to study homeopathy, the teacher started to discourage him. After studying 10 years in medical college, he started studying homeopathy because of his passion. But these guys, the so-called teachers, started to discourage him. Who is benefiting there? So, after all, we need students to study homeopathy. Without enough study, enough students, no longer there will be colleges. You know, never become teachers or professors. So what is needed is we need students. Then another thing is that I think the investment. Who will invest for this? Definitely, after completing the graduation course, a student needs some financial assistance. In certain cases, they have to support their family. So when you are attending a finishing school, definitely some stipend or financial assistance should be provided. Who will do it? That's a major question. Then another thing is that we fail to connect homeopathy with an industry. We are often lamenting we don't have research studies, this or that, but who will provide the fund? In the allopathy system, there are plenty of these multinational companies. We don't have anybody to support even our seminars to get the sponsors. That's another thing. Then another thing is that what about the duration of these finishing schools? How much time should we allow them to study, which is allowed to the student? That's another question. It's 1 year, 2 year, 3 year. How long? So then again, after that, what happens? So therefore, there's a questions. Then again, so only the persons who has got enough financial background as well as interest as well as knowledge in homeopathy can be play some substantial role in providing this or starting this finishing schools. Then we know that the 20 T20 cricket tournament is going. National tournament. You can see a wonderful performance from the American team, the Italian team, even though they are not at all playing international cricket for so long years. So how this happens? By these finishing schools. Because they are able to bring certain expert coaches and provide enough facilities for the players. So they got all these things. Then what happens to West Indian cricket? One time it was the world champions. Now what happened? Because of the lack of funding. The fund managers just divert the attention to basketball. So naturally, the shortage of fund or amenities lead to the crumbling of this Western cricket. So just like that, we need finishing schools, just like the Indian Pacers Academy, MRF and Dennis Lilly Foundation, Chennai. They create a lot of fast bowlers for India. So the coaches from from Dennis Lilly from Australia and the fund from India, the MRF Foundation, they provide the fast bowlers academy there. Just in that model, we should start the finishing schools with the help of some persons who can support us. Otherwise, it will not reach anywhere. Just like Rahul Bajaj Foundation at one time it was there. But what happens? They supported us at the time of COVID. Now where they are? Nobody knows. So this type of management is very much needed. Then again, at the event of this AI, definitely we have to depend more on AI in the coming days. So we have to adjust. We have to make some modifications to include AI in the finishing schools. Then again, the skill development is an important thing in finishing schools. How to practice, how to approach the patient, how to communicate, how to take case, how to follow. Especially we know the chronic cases, it will take a long time. So the students should give more opportunity, more exposure. Not on 1 month, 2 months, or 6 months. It may take years. Then again, the money is a major problem. Then the professional grooming is also needed, as well as the placement, the career development as a placement cells should start in our institutions. These are the things I have to share with you, Dr. Ajini, and the platform. I think Dr. Prakash Rao will join later. We can go again, Dr. Marian.
Okay. Dr. Mariam Salcedo.
Yes,
But,
yes, yeah.
Okay. After hearing Dr. Manoj and Dr. Ravi Sharma's opinions. What do you think about their opinions?
Thanks, Mama. Thanks, Dr. Manushi and Dr. Ravi Sharma. Yeah, I believe that we have different experiences with homeopathy and we have different lifestyle with homeopathy. In South America, we have spreading homeopathy, but we don't have the same experience that you have there. You there have homeopathy like a career, as I understand. So here we have sometimes to fight in our mind between the allopathic knowledge that we have in the faculties in the universities, uh, when we have to integrate the Hahnemann's thought. And maybe that is the most important thing and the most difficult thing for our professionals. The first point. The second point that differentiates us is the experience that you all have. I know that there you have homeopathic doctors that see something like 2,100 patients per day. And here, as we have just the private consultation, maybe we will see 6 to 8 patients per day. So that is a huge difference between our practice. And about the type of homeopathy that we use here, preponderant, we have classical homeopathy in Bolivia, in Brazil, in Colombia. But another trouble that we have is the laboratories. The laboratories just start selling homeopathic remedies like a pluralist medicines. So you don't need the consultation with homeopathy because you have some paper there and it's a mix of, for example, like lycopodium, nux vomica, and carbovage, like something for a better digestion. So we face different troubles, and I believe that the most important thing is the experience. You have very well spread the homeopathy, and all point of view is very values to improve our practice.
Thank you, Doctor. And in India, we have many doctors here to support us, even though we are not asking them to support us, and even they are not offering us any help. That is the thing, I think. Even though I am appreciating the doctors outside India, they have very less facilities to learn homeopathy, even though you are showing much interest and you are taking responsibility yourself and doing this. But I am so proud about IFPH. Many doctors are saying that they got confidence in practice because of their attending our webinar. It is so encouraging and motivates us to continue our webinar sincerely. That is the only power that we are getting, the appreciation from outside. Dr. Avi Sharma, you can speak now. Dr. Prakash Rao also joined. You please share your
No,
opinion.
please ask. Please allow sir to speak first, and then I can actually put my views. No worries.
Okay. Thank you so much. Dr. Prakash Rao, are you ready? Sir?
Yes, he might have rushed to the spot.
Yeah.
Always busy
That's
with
why I
certain works. You must give some cooling time, maybe.
yeah. So that time you can speak, Dr. Avi Sharma, you can talk.
So,
Then
like Dr. Manoj and Dr. Marian actually like said, when see, I'm a very big critique when it comes to like when anything bad happens to my pathy. And what am I seeing in this in these colleges today is what happened in America years ago, which actually just like with the blunder that happened in America, which finished homeopathy in America, that is actually started happening in India, integrating homeopathy with other pathies. I don't think that this should be. A homeopath needs to be a homeopath, an Ayurvedic doctor needs to be an Ayurvedic doctor, and an allopathic doctor needs to be an allopathic doctor. We all are expert in our fields, and we should be allowed to practice our fields and our field itself. This is what I believe. I think Dr. Prakash is here, and he would want to like apna start his session.
Doctor, you are welcome. We were waiting for you.
Please unmute me, unmute.
You are, and now you,
Can you
yeah.
listen to me now?
Yeah, listening. And
Now I am
started
sharing my
sharing even.
slides. You kindly go through these slides. How much time you are going to give me? You have to tell me, please.
10
Sir,
to
good evening.
15 minutes.
15 minutes exactly. 19:05. I will finish by 9:20. Can you see my slides now?
Yes, bridging the gap in homeopathic education.
Yeah, okay. Now, why this topic came? Now, I have forgotten his name. The person who spoke before me has extremely very well. He told that that every system has to be practiced separately, and that is true. That is in a spirit, in a way, it is as a matter of principle, as a matter of medical ethics. One should practice his own practice. And here would like to add that the government or the system or the medical fraternity in general, they have to accept that these are the specialist systems, and they have to cultivate a habit that they have to refer the cases. One system is complementary to other system, and the complementary professional behavior has to be developed. In India, as he told, the integrated medical system started coming up. That means it is an old wine in a new bottle. Previously, the excellent, poor, unsung heroes of homeopathy used to tell that it is a mixopathy. And that is true. And seeing the mixopathy results, and everybody is happy. For that, the reason today's topic. So, today's topic is an excellent topic that gives answer to my previous spoke the distinguished guest who told that systems are different, different fields are needed, different experts are needed, they should not be clubbed. And why it happened is it is poor system of education, the bridging gap between homeopathic education. See, there is no passion among the homeopathic students nowadays. Previously, an unqualified homeopathic doctor used to have a passion for homeopathic system of medicine. And till he dies, he used to use his system for his ailments. Now you will find every doctor taking treatment in a grand five-star hospital. Being a homeopathic doctor, he is the richest person, and he goes to an excellent five-star hospital, and he boasts that his all sons are MBBS doctors, and he is taking treatment with a super specialist, and he never trusts. At the same time, he makes cheap of himself, and he do not know that it is not good, and how the system has been survived for 250 years in a country like India. Though there is evidence is not proved, that he never understands. And this is the fate of the double standard equality of the homeopathic physicians that made us to develop this topic. So, bridging the gap between homeopathic education, need for finishing school of clinical excellence, as we producing doctor are merely degree holders. Even the title itself is highly explanatory. We are producing not the doctors, we are giving they are uneducated, qualified homeopathic physicians, absolutely uneducated about homeopathy. But at the same time, if they go to court, this quoting whatever I quoted will be upheld, and they may file a suit against me for insulting them. But they are uneducated, qualified homeopathic physicians. They are qualified, but they are absolutely uneducated about homeopathy. Present Academic Council, Board of Studies, Curriculum Review Committees, they all know that what is the defect, what is the deficiency, what homeopathy has to be needed, what is the gap that has to be filled, where is the vacuum in homeopathy, but nobody want to build the cat. Everybody knows everything. They know that they can't see medicine in potency. They know that there is no reproducibility. They know that where is the mechanism of the action of homeopathic medicines. 72 years of independence, 1960, 1972, the Central Council has formed. Neither they know, nor they know that they do not know. They are highly confused. Nowadays, the medical technology has so raised that nobody wants to take up, harbor, or rent, or hire our research. And we are fundamentally weak in our research. If ESR level comes down, we will be very happy, we will clap. And I will tell you one example of this. The people are going and organized a seminar in Dubai. In Dubai, except sand, nothing is there. No full homeopathic doctor of India is present there except for practice. To whom they are going to teach homeopathy there, and which student learns? After all, 100 and 110 more delegates that are from India are present. India is having 2 lakhs registered homeopathic doctors, 110 more graduate colleges, and around 60 postgraduate colleges, around 7 PhD institutes. None of them attended because it costs around 1 lakh rupees. The idiots in over asked that no government representative attended the meeting. How a government fellow goes there to attend a meeting in Dubai? Which fellow is going to listen to their outcome of the meeting? These are some of the problems. Now, come to the next. Why the discussion is urgent? Rapid expansion of homeopathic colleges, declining clinical confidence among the fresh graduates, increasing patient expectations and medical legal security, gap between theoretical excellence and clinical readiness. A degree certificate is learning. A doctor earns trust. Doctorship is an art of medicine. Hahnemann says in his organ on this, the clinical practice is a science and art of medicine. These fellows do not know what is the art of medicine, how to convince, how the experience will affect. They think that the degrees are excellent, and immediately, see, the homeopathy is the only professional education style where there is no disparity between senior and junior. A fellow with suit and beautiful English and wonderful AC clinic he opens, and he says that Hahnemann do not know anything. And who is the Kent? No fool nowadays. I am finding every educated person from a postgraduate institute of homeopathy, he can't even utter the first aphorism of the organon by heart. He can't tell what is the second organon, second aphorism in the organon. Why the aphorism name came? He will stand first in the entrance test that is being conducted. The highest ideal of cure is rapid, gentle, permanent restoration of health, inhalation of disease in its small extent. What is ninth aphorism? The highest ideal of, see, they can't tell. See, what is the first? The physician's and only mission is to restore the sick. Nobody can tell. They are taking degrees but not becoming doctors. The current standardization of syllabus. What is the standardization of syllabus? They add more scanning, ECG, echocardiography, MRI scan. Everything is fine. But my dear friend, my dear National Commission of Homeopathy, who will show the action of homeopathic medicines, my dear doctors? Have you gone in at any time? Have you questioned the Central Council? Have you begged with your ministry that, sir, we need this help? Do you know how to do it? Do you know that what to do it? Do you know where are the persons who can do it? Have you at any time thought, my dear think tank bureaucrat who is staying with the Ministry of Health and who is behind Prime Minister and who is behind India? See, the Indian government has taken an establishment, a note, a MOU with the WHO regarding alternate systems of medicine, where the homeopathic doctors were forced to keep quiet and all the organizations close their mouth and they cannot answer anything. And all the fellows arranged a meeting in Dubai. And which student is getting benefit out of the Dubai conference? Why Dubai? Why not in Kottayam? Why not in Hyderabad? Why not in Agra? Why not in Bhopal? Why in Nagpur? See, these are some of the double standards people of Indian homeopathic think tank, which made the homeopathic education from bad to worse. So, the third question are, we are producing doctors or degree holders? Doctors. What is doctor? Clinically confident, patient-centered, decision makers, lifelong learners. A doctor never says that I am very much experienced doctor so that I can treat a case. Every senior doctor humbly down to the earth, he says that I am seeing my first case in my life. Let me see what I will apply my gadgets, I will apply my knowledge. The cure will take place by God. When the surgery professor, the pathology professor told these words, and our young homeopathic doctor says, examination order, have you examined the patient? In syllabus, we haven't covered this particular disease. Protocols we have to follow. And post-degree uncertainty, we do not know anything. We never covered this disease. and how to examine. Whether it comes under computers, whether we can repertorize, or your repertory itself is not verified, totally bogus, and they will sit in front of table and they have written after Bogart, after Boning Hassan, after Kent, who is the fellow who has written repertory after verifying the symptom? You show me that person. Which will just they write, they will do table research and you see, climbing the third steps will give vertigo. What is this nonsense repertory? From which book he repertorized? What observations he made? How verification he has done? Nothing. And those repertories have been computerized, and those computers are being copied by these degree holders. And when they give 30 potency, it fails. When it fails, they will go under the name of the integrated system of medicine, mixes allopathy and gives, and he says it is an autoimmunological reaction. Arep Hahnemann has made a clinical classification of the diseases, which is curable, which is not curable, which is being copied by the modern system of medicine under personalized clinical, under personalized genetic, under personalized integrated medical approach. Why don't you learn, my dear friends? Taking the degrees and posing and speaking in English language is not the correct procedure of a qualified homeopathic doctors. The competency of the gap, what is difficulty in case taking beyond textbook forms. See, that fellow will fix the case record and he asked, will pleasure last birth what you were. Is it necessary for homeopathic case record? Is it necessary that so much of this one? What Hahnemann told, why don't you follow? Why the beyond textbooks format is needed for central council? Will, pleasure, first wife, second wife, first wife children, second wife children. A patient is coming to you, in what way your first wife is going to affect this patient's life. Idiotic case records. Remedy differentiation. Up to managing non-responding cases. We know that it is an autoimmune, it is a malignancy. Malignancy needs so much of gadgets, so much of medical expertise. Patient is going to die. Why you are, who asked you to attend that case and say that you failed? When you fail, the people will blame that homeopathy failed. When a homeopathic doctor failed, they never say that homeopathic doctor only failed, but they blame that homeopathic system is failed. But if a person, an oncologist, if he cures the case and if he fails in curing the malignancy of a patient, they say that malignancies are incurable. Nothing happens to that malignant specialty, super specialty hospital of cancer specialization, because that is the difference. We don't have a senior junior approach at all. They don't have manners, courtesy, and they never recognize that you are a senior doctor, you are a principal. Once they speak English because they are from convent colleges. So over dependence on repertory software, ready-made protocols, fear of independence practice. See, everywhere you will find nowadays articles that combining with and all surveys, repertory software, which repertory software, that, this, what is nonsense? When you know the materia medica very well, you will become repertory of your own and you will be the master of your own materia medica. And you know when the patient comes for some disease, you will take the case record and you will by heart that case and you will become popular physician of your that particular place. When you are popular physician of that particular place, you are the particular popular physician of the total country. But the Delhi fellow never honors you. There comes the feeling and various associations. And this is spoiling the homeopathic education. Then what is finishing school medical education? Engineering, nursing, we don't have hands, patient care, clinical reasoning. Ethics, professionalism, practices, readiness. Everywhere it is present. A nurse gives maximum respect to her senior nurse. A nurse respects the doctor. A doctor, junior doctor gives respect to senior doctor. But in homeopathy, the pharmacist of homeopathy never cares his chief medical officer in the institutes, because the curriculum is like that. And why homeopathy needs finishing school? Homeopathic individualized case analysis, longitudinal patient follow, high congenitive decision. What is? These all can make a mastered by the exams alone. I can answer any tick. See, I will pass all examinations by ticking, all entrance examinations, because I read materia medica and philosophy, I can tick everything. And I am the person who created the question paper. And this is only masters me in passing the examination, but they never master me as a clinical expert, as a doctor. Policy recommendations. Teaching hospitals, research institutes, CCRH units, credit recognition. See, where is the inpatient homeopathic hospital attached to any other? Just keep your hand on your heart. Ask your conscience, my dear owners of the colleges, how many inpatient hospitals you are running and how many patients are filled. Why the inpatient is not coming to your hospital to take treatment, my dear son? Have you thought at any time you are showing your 1:2 ratio? See, if there is two seats, if there is one seat, there will be two patients. You are showing the 1:2 ratio patient, and have you at any time filled up your hospitals with the full of the patients when you are writing, when you are popularizing your college? What is your hospital outcome, my dear sir? Have you compared yourself with any All India Institute of Medical Sciences or your district headquarters hospital? Sir, at any time have your beds are full? Does any college owner respond to my question? Does they have these guts? What answer we will tell to Hahnemann and Kent if they ask? Does they have this speciality? No. This is the another drawback of the institute's owners. And what is key take-home message? Degree creates eligibility. Finishing schools create doctors. Clinical excellence is not accidental. It is trained. A call to academic councils. Let us move from quantity to quality, from degree production to doctor formation, from curriculum completion to the technical competence. My dear sir, my dear policy makers of the country, my dear owners of these colleges, institutes, my dear owners of the pharmaceutical companies, my dear richest fellows of homeopathy, please don't make homeopathy substandard by your double standard tactics. Homeopathy is dying. WHO has not recognized. WHO has sent, make some research, and WHO think tank so ignorant, they do not know that in India there is a 500 years of degree course, 3 years of postgraduate course, and there is a doctorate PhD course. They are unaware. Nobody explained. They think that white, brown skin people are only in America, the RNP unqualified doctors, Switzerland doctors, New Zealand doctors, Australian doctors, American doctors, London doctors, German doctors, French doctors, Byron companies are only the competent persons allowed to admit to practice homeopathy in the country. The WHO idiots, think tank, useless fellows do not know that what is the style of education in homeopathy. They have to learn a lot. This is the thing which made the president of America to quit WHO, not to care, because their unnecessary lack of knowledge and intervention is spoiling the administration of the country. The same effect is on India. Now the homeopathy is uncared. My dear institutional heads, if you do not know, don't behave. See, our beggars homeopathic doctors will go from here to foreign countries to teach homeopathy and to learn homeopathy and get a degree from Switzerland. In Switzerland, who is practicing? One painter, one carpenter, one plumber, one engineer. My dear doctors, whom you are teaching, with whom you are bluffing, with your own countrymen. Please don't cheat the countrymen. You can cheat others, but at least, my dear doctors, don't cheat yourself. Going to some other country and teaching something and getting some degree. Where is the qualification that offers degree, my dear sir, except Brazil and South Africa? What degree you are going to get which is not possible and not present in Indian country, sir? When you test yourself, heal thyself, put your question your conscience. Kindly make think tank fellows. You do not know that you do not know. You do not know that who knows. You are sleeping. You are idiots. You are fools. My dear policy makers, my dear government of India, my dear planning makers, my dear political leaders, kindly think what is homeopathy. Go through the homeopathic system of medicine. Despite of all these things, some goodness, though the rose plant is full of thorns, it is having a bright rose. The homeopathy, despite of all these things, it is not going to die. It may change the shape of it. A rose is always a rose. Rose will be present always, despite of thorns. So neither do I desire kingdom nor heaven, never immortality. I desire annihilation of sufferings of healthy human beings. Thank you very much. I completed my 15 minutes given time. I hand over my other speech to other next speaker. Thank you very much, Manoj. Thank you very much, Ganesh. Thank you very much to Kurubji and everybody who provided me this opportunity. Thank you, sir.
Thank you, Dr. Prakash Rao, for sharing your opinion here. Dr. Manoj, we have 5 minutes more.
Yes. Yes. Dr. Prakash Rao, as always, is
Yeah.
discussing different types of problems. Also point out beautifully in a critical manner, rather. That is most important thing. Is always censorious. The rubric is censorious. Anyway, what is more needed is that such the solutions. Questions are there, always there.
Yes.
Just like you remember, think about the London School of Economics. It produced a lot of presidents, prime ministers, and eminent persons. So just like that, we should have certain institutions. But unfortunately, that never happens because not of the problem of the teachers or other things, but we are always obstructed by certain fellows from the other schools to protect their industry. Then another thing is that this is not a simple substance, simple thing. A complicated, complex art. So through a school, you cannot develop an artist. You can modify the one who cannot sing, may not be able to sing after going through a musical school. It's not possible. So what is needed is more suggestions are needed. We can criticize everybody. How you can make all these things?
But the big
That
suggestion is
not
the
yes,
think
sir.
tank has to be removed. They know what they have to do. See, take the one company owner, pharmaceutical company person. He says about single dose and dias, but his company will produce cough syrups and he mixes all the homeopathic medicines. He do not know what is the chemical structure and he proves a clinical study. His conscience says that he is doing wrong and nobody opens their mouth. This is number one. They know that they are doing injustice to the system. They know the college owner knows that there are the beds have not been occupied. He know how to treat, how the Kent has admitted a case, how Hahnemann has treated inpatient hospital, how the Royal London Homeopathic Medical Hospital has been opened, how the staff nurses were trained in the Royal London Homeopathic Medical College. Why not a private medical college in India? And the owner of that never thinks of filling his beds with genuine practice. If they send you there, you will have wonderful practice and their beds will be fulfilled and they will have full strength and a graduate gets confidence when you are treating a case. But where is that? My research hospitals are present. Always whenever director or minister comes for visit, we will call the beggars and fill the all government hospitals everywhere in India. We call the beggars and fill the beds, and we will show that our beds are fully occupied. When the how many days? Why don't you the genuine practice that is being practiced in clinics will not be converted into hospitals? Why they have not given opportunity to Dr. Dhanush? Why they have not given opportunity to Dr. Manoj? Why they have given to opportunity a fellow who don't have any interest on homeopathy? Where this passion is present in the institutes, running a institute, bringing degree and sending them and making them to go to streets and ask them to recognize homeopathy instead of filling the beds with patients and curing the cases. There are hardly 36 asthma articles that are clinically written. Epilepsy contains only 13 articles. Viral impetigo contains only 1 article. Thyroid hypothyroidism, the reproducible articles are only 21. How to convince the modern medical system doctors? They are ready to accept. They don't have anything. But if you cure a case, definitely they will accept. So the whatever you are doing in clinic, how many clinics are needed? We have 120 bedded hospital attached to every institute. So why not at least 60 beds are filled? What happens to the deliveries? How RMT doctors managed for 100 years without any qualification? The homeopathy, they saved the system in 1945. The first rule has come in 1965. The homeopathic rules have came. Well, KG Saxena has brought it. Before KG Saxena, homeopathy was lying. Homeopathy was present in India and successful practice was also present. What happened to that spirit now? English speaking is not homeopathy. I am not denying that every student is not up to the mark. Few students are there where it is coming as a general property, and the private nursing homes who are managing, some of them are in London, some of them are in Lucknow. This is the status.
Thank you, Dr. Prakash Rao. Now we have to hand over the session to next team. Thank you so much
Thank you.
for your opinion.
Self-introspection.
Actually, those who got confidence, they have to show the generosity to teach the juniors. Like our said sir is doing 6 months, he is giving training without any.
The confidence has to be converted into evidence. This was previously, but nowadays the evidence has gone. The only show business is running. Even the RMP doctors are having high confidence and they are successful.
Thank you, sir.
That is the most paradoxical state of homeopathy.
Thank you so much, sir. Now we are moving to the Dr. Ramparvesh sir raised hand, but we don't have time to. We don't have time.
Namaskar, everyone. Namaskar, and panelists, doctors. Very, very thanks, Dr. Prakash Rao, Dr.
Namaskar.
Dr. Devi Sharma, and Dr. Marian. Very, very thanks. Doctor, difference between degree holder and physician.
Thank you, Doctor. Thank you, Dr. Ramparvesh sir.
So,
And thank you, panelists. And thank you all the participants. Now we are moving to the Malayalam session. I am inviting Dr. P. Shaila for moderating Malayalam session. Thank you all the participants in the English team. Good night. See you the same time.